interesting phenomenon that seems to be really unique to this virus. So phase one is that kind of cold and flu-like symptom set, and then you go into this pulmonary phase. And what we're telling people is if you're having fevers and especially if you're getting short of breath, that's when you really need to be tested. And if you're significantly short of breath, you need to go into the emergency department to be evaluated. What we're seeing as well is people who are coming in kind of having flu-like symptoms with the muscle aches and fever. And then when we put a pulse oximeter on their finger to test how much oxygen is in their bloodstream, they are dramatically low. And typically a normal human being who doesn't have any lung disease and is healthy walking around is going to be pretty close to 100% oxygen saturation. In the medical field, we generally say 94 to 100% is normal. And once you go below 93%, that's when we as health professionals really react to that, and we'll start thinking about putting you on oxygen. Once you drop into the 80s, that can really become life-threatening, where you start to see cellular death and organ dysfunction, and kind of in that mid-80s range is where if an ER doctor sees you, they will likely be putting you on oxygen and be thinking about even ventilatory support, putting you, intubating you in the mid-80s if you don't recover with oxygen. And so with regular pneumonias, regular lung diseases, regular ARDS, which is acute respiratory distress syndrome, that's how that acts. And mid-80s makes us freak out, and we want to get you back up into the mid-90s. And if you don't, intubation becomes kind of the next step. Or sometimes what we call non-invasive ventilation as an intermediate step, where you're on a mask that provides pressure and acts like you're intubated without actually putting a tube down your throat. Now with COVID-19, it's acting very differently, where we're getting people coming into the emergency department with flu-like symptoms and putting an oxygen sensor on their finger and seeing that they're in the low 80s, 70s even perhaps. And I've seen reports down below 70% should kill you with typical illnesses if you don't get on top of that very, very quickly. We're seeing people even lower than that. So then the question becomes, well, is that pulse oximeter accurate? And so the next step is to take some oxygen out of or take some blood out of somebody's artery and actually measure the oxygen content. And it is showing us that they're that low, that they're in the 70s or sometimes even 60s. And the interesting thing is, normally if you took me and dropped me down to 85%, I wouldn't be able to talk in full sentences. I'd be gasping for air. My heart rate would be up. I'd be breathing more rapidly. And very quickly, you start to not mentate normally. You don't make sense, or you get delirious because your brain's not getting the oxygen that it needs. Right. But with COVID-19, we're seeing people with these dramatically low levels in the 80s, 70s, sometimes even 60s, who are sitting there comfortable, talking to us, normal heart rates, not breathing fast, normal mental status, and it doesn't really make sense. And the thinking is that the oxygen's not getting into the, from the lungs into the bloodstream because of this inflammatory process, but that the carbon dioxide that's produced in your body is getting cleared. And it's the carbon dioxide that gives you that sensation of shortness of breath. And it's that carbon dioxide more than a low oxygen level that your body reacts to start your heart rate going faster and doing all the other physiologic things to try to help you survive. But with COVID-19, even though the oxygen levels are dramatically low, the carbon dioxide seems to be getting cleared. And that's why people are feeling okay at these really low levels. And then that begs the question for those who then get supported with oxygen, maybe we can avoid, a lot of these patients have been getting intubated and put on ventilators because the emergency medicine doctors and the ICU doctors are reacting to this number that traditionally requires intubation. And now we're beginning to question that about whether some of these patients don't need to be on a ventilator, and they might actually do better just on high flow oxygen. And that if you can give them that oxygen support for a day or two, a lot of them actually seem to turn the corner. There are still going to be some who don't do well and need to be on a ventilator, but there seems to be this critical hump that if you can get people over it, you may get beyond the worst of the disease.
Can you talk a little bit more about that, like as far as the numbers? So to kind of recap on what I'm hearing here is, you as normal folks, we could potentially even, you know, we have a fever, flu-like symptoms, but we don't even know that our oxygen levels are dropping, because unlike other, we might not, the shortness of breath may not even be there because our oxygen levels are dropping, and you've seen some patients do that. So kind of having access to a pulse oximeter at your home, and now there's some apps that could do that, that would, how much benefit would that provide people? Well,
enough that I went and looked on Amazon into getting my own pulse oximeter, you know, and all of a sudden they used to be $15, and now the cheapest is 60, and they're generally not available for this very reason. You know, the question is how much clinical utility is in there. It may be a marker that if you have a pulse oximeter at home and you're getting flu-like symptoms and you put it on your finger and it's low, you know, that may be a marker that you might have COVID infection and probably should be tested. You know, it is also a way to potentially monitor somebody at home. If you're thinking about trying to take people who are not critical and keep them out of hospital settings, you may be able to do some in-home monitoring that way. Because basically what I would want to monitor is, let's keep an eye on that oxygen level, make sure it doesn't go too low, and do some kind of video monitoring, or be able to call somebody on a regular basis and say, hey, how are you feeling? Because that's the other, if somebody has low oxygen and they start to not feel well or breathe rapidly, that could be a marker. I would also want to be able to monitor their heart rate, because if their heart rate ticks up, it had been normal and all of a sudden goes high, that's probably a reaction. It either means that the body's not compensating as well, or even possibly you're having an abnormal heart rhythm from, you know, the COVID infection affecting your heart. You asked about numbers. So 80% of all people get minimally symptomatic to asymptomatic. Of those who essentially need to seek hospital care, about 80% of them can be more or less kind of sent home and told to home quarantine and be monitored. About 15% require in-hospital care, and about 5% become critical, give or take a few percentage either way. The data really, when you look at Italy, Spain, Seattle, New York, the data looks a little bit different in each area, and there's been questions about whether air pollution affects it. You know, Northern Italy, the patient population by and large was older, and that probably affects how many become critical. There's underlying disease processes that affect how sick somebody gets with COVID. So a lot of different factors. So, you know, I want to be careful about quoting numbers because they do look different in different areas that have been hit hard, but more or less that's accurate.